How to have a healthy first trimester. A typical pregnancy lasts approximately 40 weeks and is broken down into trimesters. The first trimester is considered the first 13 weeks of your pregnancy. During this time, your body is adjusting to the new life inside of it, and it is essential to take all the necessary precautions to ensure you and your baby are as healthy as possible. Visiting the doctor. Find a good health care provider. If you don't already have an OB/GYN doctor or midwife that you feel comfortable with, start doing some research or ask friends and family for referrals. Good prenatal care is extremely important throughout your pregnancy, and you want to choose a doctor or a midwife that you feel comfortable with. Schedule a prenatal appointment. It is important to schedule an appointment soon after you discover you are pregnant. Studies show that women who do not receive good prenatal care are at a higher risk for having low birth weight babies and babies with poor health than women who regularly see a physician during pregnancy. Know what to expect at your prenatal appointment. In addition to confirming that you are pregnant, the first prenatal visit includes a variety of tests and examinations to assess your health, as well as the health of the fetus. It also helps establish the relationship between you and your health care provider. A typical first prenatal visit includes questions about your current and past medical history, including medications you take, smoking history, current health and previous illnesses, procedures, pregnancies, and family history, including any genetic conditions that run in your family. Dating your last period to determine a due date. A physical examination, including a pelvic examination and a Pap test. Testing for sexually transmitted infections. Taking your weight and measurements. Blood pressure measurement. Urine testing for proteins and sugar levels. Ultrasound to hear the baby's heartbeat, which oftentimes is not heard until at least 6 or 7 weeks. Questions about your current and past medical history, including medications you take, smoking history, current health and previous illnesses, procedures, pregnancies, and family history, including any genetic conditions that run in your family. Dating your last period to determine a due date. A physical examination, including a pelvic examination and a Pap test. Testing for sexually transmitted infections. Taking your weight and measurements. Blood pressure measurement. Urine testing for proteins and sugar levels. Ultrasound to hear the baby's heartbeat, which oftentimes is not heard until at least 6 or 7 weeks. Schedule upcoming prenatal visits with your doctor. Even if your first prenatal visit went great, it is still important to continue seeing your doctor regularly throughout your pregnancy. Prenatal care typically consists of a visit with your doctor once a month for the first 6 months, twice per month during the 7th and 8th months, and then every week after that until you deliver. Talk with your doctor about prenatal testing. Towards the end of the first trimester, your doctor may talk to you about prenatal testing to further assess the health of the fetus. You can decide which tests you want to have done, but they will help determine things like genetic disorders, birth defects, or the potential for other disorders. These tests are encouraged so that you can make the best health care decisions before and after your child is born.